Welcome back to Therapy Thursday. As many of you know, Dave and I recently visited Dr. Stuart McGill at his home. One of the coolest things that we saw there was this little guy. It's so cool, in fact, that we felt that we had to go out and get one for ourselves. It recently arrived in the mail, and we know it's going to improve patient outcomes. It's created by a company called Dynamic Disc Designs, and it's based on Dr. McGill's lab data showing exactly how a low back actually works, including the disc component. We utilize this to better educate our patients, and we know that it empowers them to have better outcomes. Let's take a peek at the cool things it can do. So this entire design is simple. It's got two vertebral bodies and one disc in between, and you can show all kinds of different types of back pain, whether somebody's twisting, extending, or flexing. It will change the actual dynamics just the same way it would in the human body. So you can show if somebody's got extension-based pain that it will physically potentially jam the joints in the back side of the back, but more importantly, and the one that we've had most utility for, is pain when flexing forward and somebody's clinical signs show that it might be a disc problem. You can see from the top part, they've created a little tear inside the disc, and that corresponds out the back. You should be able to see a little red part in there. Now, as I flex forward, recreating somebody's sharp back pain when they're flexing forward, you can see that some of the disc material can slide back. That's one of the ways that people get pain with forward flexion. It's not everybody, but it's certainly a large number of people, specifically if they have disc signs on clinical evaluation. So this just helps the person actually understand their model of back pain and how certain specific types of therapy and exercise will then help prevent it. We are big believers in empowering people through education, and this is one of the best tools we've ever seen to allow people to do so. We'll see you next week on Therapy Thursday.